Good morning, everybody. My name is Oreoluwa Raymond Akinbote, a PhD student of Integrated Bioscience at Tuskegee University. And today I'll be talking to us about infectious bronchitis. At the end of this lecture, I'm hoping participants will be able to describe the etiology and virological characteristics of infectious bronchitis virus, including its classification and major variants affecting poultry, especially in the US, and then be able to explain the transmission and pathogenesis of the disease, identify the major clinical signs and postmortem lesions associated with infectious bronchitis, and be able to describe diagnosis, economic impact, prevention, control, and vaccination. So, this is just a brief overview of what infectious bronchitis is. The disease was first recognized in the 1930s, and since it was recognized, it has had a significant economic impact in all countries with major poultry production industries. And infectious bronchitis is caused by coronavirus and is characterized by respiratory distress and, in some cases, renal problems. In long-lived birds, infectious bronchitis results in reduced egg production and deformed, discolored, and thin-shelled eggs. So, like we said earlier, infectious bronchitis is a member of the coronavirus family, and then the avian coronavirus family contain four major structural proteins, which the envelope, the nucleocapsid, the membrane, and spike proteins. And spike proteins are scattered across the surface of the virus. And it's very important for us to note that the spike proteins are actually what's responsible for why we have many variants or serotypes or strains of infectious bronchitis. And then we know that the coronavirus actually gets its name from the Spanish word corona, which means crown. And if we look to the image we have on the right side of this screen, we'll see like it looks like the ball here is wearing a crown, or it looks like a crown. And so that's basically where the name corona comes from, because it microscopically looks like a crown. So in the United States, we have endemic strains to the United States. And some of these strains that are endemic to the United States include the Massachusetts strain, the Connecticut, Arkansas, California variant DE072, Georgia 98, Florida, GMK, Iowa, Gray, Alt, SE17, Maine 209, and Clark 33. So these serotypes have been well described in the United States. So this slide is talking about the host range. So infectious bronchitis primarily affects chickens, although chickens of all ages are susceptible, but it is very severe. It shows more severity in young birds, and that's because young birds do not have a fully or well developed immune system like adult birds. So what might be mild in adult birds would be severe in the young birds. And then the layers and breeders, because they are of reproductive importance, because they lay eggs, they experience reproductive impacts of infectious bronchitis. Transmission of infectious bronchitis is mainly through respiratory droplets. So when infected birds sneeze, they sneeze out these viruses into droplets, which are spread in the air to other birds. And then once these other birds should have direct contact with these droplets, they get infected. So direct bird to bird contact in a way is also a rub off of they spread via respiratory droplets. So when birds that are infected get in direct contact with birds who are not, it's expected that the disease is going to spread. So also through contaminated equipment, clothing and litter, and this is why biosecurity is very important. So imagine you're moving equipment from a pen house where birds have already been infected and then moving them to a pen house where the birds do not have infectious bronchitis. You're literally introducing the virus to the new group. So it's very important to keep biosecurity in check to curtail the spread of infectious bronchitis. And it's very important to know that the spread of infectious bronchitis is very, very, very rapid. It can infect just one bed can, bring down tens of pen houses, so it's very rapid. Pathogenesis of the disease. So after the virus enters the bed through the respiratory route, the virus finds its way to the respiratory epithelium of the nasal turbinates and trachea. And it's at these points that we start to see the clinical signs where, because of the discomfort that's going on in the trachea and the nasal turbinates, the birds begin to sneeze, shake their heads, and cough. And from here, that's the early onset. From there, depending on the tissue tropism and the virulence of the IB strain, the virus can migrate from the respiratory epithelium to other organs. An example is the renal tubules, the kidneys, where it can cause kidney lesions, and then in the oviducts where it can affect the reproductive efficiency of the bird. So the pathogenesis of infectious bronchitis is similar to that associated with pneumovirus infection. However, infectious bronchitis virus almost always causes symptoms of varying severity, in addition to renal lesions, whereas pneumovirus often causes infections that remain subclinical. So clinical signs in broilers. Broilers are, as we all know, chickens that are bred for their meat, and the clinical signs of infectious bronchitis are typical of any respiratory disease. So they include, head shakes, chickens violently shake their heads, they cough, they sneeze, there's muscle hemorrhage, there's difficulty in breathing, and tracheal rales with serous, catarrhal, or caseous exudate. So tracheal rales in chickens can be likened to wheezing sounds in human beings when breathing. So typically when we breathe in and out, when we inhale and exhale, it should be clear with no obstruction and no sound. So when we make sounds when we inhale or exhale, it could point to little obstructions in the trachea, in the airway. So tracheal rales in chickens sort of equate to that, where the chickens kind of make sounds when they breathe in and out, and it's really discomforting. So how we check that out is when you see birds that are struggling or already shaking their heads or sneezing, and you pick them up and then you listen closely to how they breathe, you can hear the rales. It's literally like grating. It has this grating sound as they breathe, and can imagine how discomforting that would be. So excessive tearing and conjunctivitis, you see them tearing, and then sometimes the eyes are swollen, and swollen sinuses, depression, decreased feed intake. For birds that are already struggling with cough, sneezing, they of course lose their appetite because they are conserving energy, weak, and so they eat less. And then the air sacs may contain caseous yellow exudates. Clinical signs in layers. So layers are birds, of course, that are reared for their eggs. So because they are reared for their eggs. Infectious bronchitis affects the reproductive capabilities of these birds, so there is a drastic drop in egg production. Sometimes the drop is between 10 to 15%, although some farmers have reported as high as 40%. And you start to see a drop in egg quality. If you open up the egg, the albumen might be very liquid, and on the outside, on the shell, you'll see discolored, misshapen, thin and fragile shells with calcium deposits. On the inside, in postmortem, you can also see degeneration of the ovary, inflammation of the oviducts, and peritonitis. So peritonitis is usually as a result of a problem that's going on in the ovary. So as we know, the ovaries contain follicles, and then once these follicles mature, they grow, and then they sort of get through the oviduct and then go through the shell gland and then eventually become eggs. But when infectious bronchitis affects the ovaries, and these follicles are supposed to mature and then eventually become eggs, they somehow become flaccid, and once they become flaccid, lose their shape and form, they rupture, and then once they rupture, they get into the abdominal cavity, and that's the wrong place they should be. So once they get into the abdominal or peritoneal cavity, or opportunistic bacteria, of course, will feed on it. There's E. coli, there's other stuff trying to, because it's a very rich media for their growth. So there is a crazy reaction in the peritoneum, and then the body is trying to, fight it with the immune system. So that's what results in the peritonitis. So most of the time, when you see deaths in birds due to peritonitis and it's confirmed they have infectious bronchitis, best believe the peritonitis killed them way faster than the infectious bronchitis, because it's a very nasty reaction that's going on in the peritoneum. So if we remember, I said earlier in this lecture that there can also be kidney involvement of infectious bronchitis, where the virus can migrate from the epithelium of the nasal turbinates or the trachea down to the epithelium of the renal tubules and the kidneys. So in a situation where we have that, and it's common to the nephropathogenic strain, in a situation where we have this strain migrating from there to the kidneys, you would have a swollen kidney, it becomes pale, and then you can see urate deposits in the ureters. And because of this, birds would increase their water consumption and the amount of droppings, and which would definitely lead to wet beddings and dirty plumage. So now we're getting to the postmortem lesions of infectious bronchitis. So on this slide, we can see two images of the trachea, one on the left, one on the right. We can almost tell which one is infected by the level of congestion we see. So the one on the left here is very likely infected because it's congested and hyperemic and with exudates in it, and the one on the right is normal. This is what the normal trachea should look like. So we can see by contrast how bad it can be, and imagine the kind of respiratory distress this bird on the left would feel. And just to put things in perspective, so if we remember in the previous slides, I mentioned that infectious bronchitis can also cause degeneration of the ovaries. So with this image we have on the left, if we look at it clearly, we'll see that the ovaries here are smaller than normal. And then to put into context, this image was taken from a 53-week-old breeder broiler. For a bird that has laid eggs at some point, to have ovaries that are this small is indicative of something. So Infectious bronchitis can cause this. And if we look to the right, we'll see that we have some sort of cysts. So yes, infectious bronchitis also can cause cysts in chickens. Here we have more lesions of infectious bronchitis. So we can see on the left here where we have labeled the alphabet K. This is the kidney of the chickens. If we're familiar, excuse me, if you're familiar with the anatomy of the chicken, we would know that the kidneys of the chicken should actually lie in the cage of the vertebrae. They shouldn't pop out, and this is sort of already popping out. So the kidney is very well enlarged, and if we look clearly here, let me see if I can highlight that. If we look here, we can see urate deposits in the ureter. So this white band streaking down is actually indicative of urate deposits in the ureter. So anytime you see urate deposits in the ureter this way, it's indicative of faulty kidneys. It means the kidneys are not filtering as much as they should. Even if the bird is drinking water, it means this is a sign of dehydration anyway, and that's because the kidneys are faulty. So we can also see the urate deposits on the right. The right here we have the liver. So you can also see the urate deposits scattered all over the liver because the kidneys are not expelling the urate, so it's scattered all over the viscera. So here we're going to be looking at the effects of infectious bronchitis on air quality. And here we have an array of different air qualities and how infectious bronchitis can affect or cause these different pathologies in air quality. So A is just for reference. A is a normal egg. That's what a normal brown table egg should look like. And then B is just a slight alteration from what A is. But from C we can tell the impact of infectious bronchitis on laying chickens. So in C we can see the pinpoint calcium deposits. On C and H we can see that D is just a soft shelled egg. D and J very soft shelled. E misshapen. F misshapen. G also misshapen. H pinpoint calcium deposits. And I so is also misshapen and very fragile. So this is how much damage infectious bronchitis can do to the egg industry. So imagine you're already losing. It's enough that you're already losing money or losing financially to your egg production dropping, let's say 15%. You're already losing in that part, and then the remaining eggs you manage to get, they are of this quality. It's so bad for business. So infectious bronchitis is of great financial or economic importance to poultry farmers, especially those in the laying egg or table egg industry. So how do we diagnose infectious bronchitis? We can diagnose infectious bronchitis with clinical signs and flock history through virus isolation, PCR detection of viral RNA, and the serology. Now that was ELISA testing. So in many parts of the world, especially Africa where I am from, we rely so much on clinical signs and flock history and serology for the diagnosis of infectious bronchitis. because virus isolation is way too expensive and it's not economical for the average farmer. Then PCR detection, of course, is also expensive and not economical. So clinical signs and flock history. If you're a vet consulting for a poultry farm, for example, and then you get to a farm, you see respiratory signs. The live birds are sneezing, coughing, shaking their heads, rattling sounds or tracheal rails and all of that when they breathe. And then you collect the dead birds and then you do a post-mortem on them, and then you see kidney lesions, for example, or you see cysts, or hemorrhage in the breast muscles. Then you might start to wonder, is this infectious bronchitis? But all those lesions are not pathognomonic. They don't hit the nail on the head. So you still have to combine that with flock history. So then if you ask the owners of the farm and then they say, oh, they didn't vaccinate against infectious bronchitis, especially in a region that infectious bronchitis is endemic, like Nigeria, for example, you just know, okay, yes, this is a very big possibility. Then serology, on the other hand, is where you check the antibody level in the serum of chickens. So you collect blood from the chickens, tests, and then run ELISA and then check the antibody level of infectious bronchitis in the blood. So if you've not vaccinated, or even if you vaccinated and the antibody level is higher than the desired or expected range, you can tell that there's a field infection because they are fighting an active infection. So that's how we used to diagnose infectious bronchitis in Nigeria, where I'm from. What's the economic impact of infectious bronchitis? Number one is reduced weight gain in broilers. So as we know, infectious bronchitis is a viral disease, and most viral diseases cause immunosuppression. And once there's immunosuppression, there is a high chance that secondary bacterial problems will start to set in. And once secondary bacterial problems start to set in, there is also a high chance that your broilers will not attain the desired weight. In layers, on the other hand, there is going to be a drastic drop in egg production, and then we already saw, I think we've seen why that's possible, because the virus has a tendency or the ability to migrate to the follicles, the ovaries, where it can, cause degeneration and then cause, flaccidity or distortion of egg shape and quality. Increased mortality. Again, just like I said, because it's a virus, infectious bronchitis itself may not lead to mortality, but secondary bacterial infection will probably be the main cause for the high mortality. Then if your birds get infected with infectious bronchitis, the cost of vaccination at that point is going to be expensive, and then the control measures. So like they always say, prevention is always better than cure. So if you want to spend less, it's better you spend more on prevention. Prevention and control of infectious bronchitis. The first way to control or prevent infectious bronchitis is through vaccination. We'll be talking a little more about vaccination in the next slide. But for now, let's talk about biosecurity. Biosecurity is, if not the most important part of prevention and control, it's going to be on top of the chart. It's, in my opinion, can prevent majority of the infectious diseases we have in the poultry system. So strict biosecurity entails controlling what you let into your farm and what you let out of the farm. So your food dips, your wheel dips, your bath systems, and your hygiene, your terminal cleaning, it's very, 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 very important. So another way we can prevent and control infectious bronchitis is good ventilation in poultry houses. because these viruses are actually like spread as droplets in the air. If you have good ventilation in your poultry house, it's going to reduce the chance of spread of this virus. Although it doesn't bring it to a zero, but at least it reduces the chance. Then here we have the all in all out system. What this means is when you have a particular pen house, make sure that all the birds in that house are of the same age, and the day they are coming in, all of them come in together, and the day they are leaving, they all live together. So you're not mixing ages. You're not going to have birds of, let's say, 2 weeks and birds of 7 weeks in the same house. That is giving rise to not just confusion but the opportunity for diseases like infectious bronchitis to creep in. So let's talk about vaccination. Broilers are vaccinated using live vaccines with significant variability in vaccination programs between countries. Normally, the first dose is administered in the artery on the first day of life using coax spray. And why they do it in the artery on the first day of life, and sometimes, most of the time, they don't repeat the vaccination, is because broilers are kept for a short period of time. In Africa, we keep them, or let me say in Nigeria, we keep them for about 6 weeks, give or take 6 weeks. So there's almost no room for you to repeat the vaccination. So once you give them at the artery, it covers them all through the lifetime. So in breeders, on the other hand, that you're going to be keeping a little longer, live vaccines are typically administered on 3 or more occasions depending on disease incidence, with significant variability in the intervals between vaccines and the strains used. An inactivated vaccine is subsequently administered at 15 to 18 weeks of age. It's very important to match vaccines to circulating strains. This is very, very important. It's not just about using vaccines. Are you using the right vaccines? So in Nigeria, let's say we have a strain IB491, and then in the US, we have the Connecticut strain, for example. So you're using the Connecticut strain vaccine in Nigeria, where we have the IB491. You're not going to get protection because the strain of the vaccine you're using is not the strain of the virus that's endemic to them in Nigeria. So you have to be precise and match the right vaccines to the circulating strains. So first, you must know the strains of infectious bronchitis that's circulating in your environs before you determine the type of vaccine to give. So in the United States, the most used vaccines are those against the Massachusetts strain, Arkansas, and Georgia serotypes. And those against the Connecticut serotype appear to be rarely used nowadays, as the incidence of this strain is currently close to zero. The importance of infectious bronchitis for poultry production. So far, we know that infectious bronchitis is a major disease in commercial poultry systems, not just because it affects production, but also because of its debilitating effect on immunity. By weakening the immune system, it lets secondary bacterial infections come into play and even do more harm than the infectious bronchitis itself. So it is very important to carry out continuous surveillance. It is usually advised that 6 weeks, or at intervals, not necessarily 6 weeks, but at intervals, reasonable intervals, to carry out serological monitoring of the farm. So you collect blood and then you run ELISA to check the antibody levels of infectious bronchitis to make sure that your flock is protected against infectious bronchitis. It's important to incorporate integrated disease management. This is not just a matter of treatment, it's a matter of integrating prevention, because again, prevention is always better than cure. So it's important to have very good biosecurity before you even start to think of treatment, because if you have good biosecurity, then you're preventing diseases, then you will have to spend less time, resources, and effort on trying to treat the disease. In conclusion, infectious bronchitis remains a major global poultry disease. Almost every country, every major poultry producing industry has at some point had issues with infectious bronchitis. So it is with us, it is something we need to pay attention to, and it is something we need to try as much as possible to prevent by improving our biosecurity, so we can limit and curtail the rapid spread of infectious bronchitis. Then we know now that vaccination and monitoring are also very key to controlling infectious bronchitis. Thank you very much for your rapt attention. I remain Oreoluwa Akinbote. Thank you.